Are you currently suffering from hip or buttock pain that's worse first thing in the morning or after prolonged sitting? Hey everyone, this is Dr. Zach Groin here, Performance Sport and Spine, and in today's video I'll be discussing hip osteoarthritis. So the hip joint is a ball and socket, with the socket being the acetabulum of the pelvis and the femoral head of the femur or thigh bone. Hip OA is the #1 cause of hip pain in the elderly, and it affects up to 240 million people worldwide in activity limitations. And please like our video, subscribe to our channel, and then don't forget to turn on notifications. What does this condition feel like? Well, it often presents as stiffness and pain of the groin or buttock region. The pain and stiffness is often worse first thing in the morning or after prolonged sitting, and usually gets better with movement within 30 minutes, and often rest improves this condition. And now we'll talk about 4 cardinal signs of hip arthritis that you need to be aware of. Number 1, there's loss of range of motion, especially in the rotational or abduction axis. Number 2, difficulty putting on your shoes or socks. Number 3, having difficulty getting in or out of your car. And then lastly, there's difficulty with sitting cross-legged on the floor or other surfaces. Hip OA is rarely seen in people under the age of 30 years old. So what causes this condition? For a long time we thought of this as a wear and tear problem, where basically the more you use it, the worse it got. But it turns out that this is a complex biological process, and there's a lot more going on here, involving tissue metabolism, anatomical and physiological changes, inflammation, and loss of function. And this condition affects all the structures of the hip, including the bone, cartilage, synovium, capsule, ligaments, tendons, bursa, and muscles. 2 diagnostic criteria that can be helpful for diagnosing this condition are internal rotation of less than 15 degrees and then osteophytes, which are basically bone spurs found on radiographic films. And then the 2 of these combined is even better. Now we'll start the exercise and rehabilitation portion of this video, but it's important to note that hip OA and knee OA, all patients, the first line intervention is weight loss, education, and exercise. So this doesn't matter if you're just with mild symptoms or you're going into surgery. This is important for everyone. For all these exercises, all you need is a wall and an exercise ball. And we'll do level 1 more initial, and then level 2 more advanced, and then we'll also show you 3 accessory exercises that are great for this condition. The standing hip raise. So placing your inside arm against a wall or an object to brace yourself. We're going to lift the inside leg up and then hold a tolerance. The goal is to hold for 20 seconds or work up to that, but if you can't do that initially, that's fine. Just start less and then increase over time. But again, raise the inside leg, not the outside leg, because you'll feel more stable. And then repeat on the opposite side. But again, raise your inside leg up and then hold the tolerance, working up to 20 seconds. And then standing hip abduction. Placing both hands on the wall, we're gonna lift one leg up a little bit, feeling some tension on the outside of our leg, and then bring it in. Work up to 10 reps, but again, the goal is to build up the hip strength, not increase mobility. So if your hip gets tight at some range, just work within that range, because remember, there's changes to your joint, so you might have less range of motion than you used to have. And then perform on the opposite side. Glute bridge, laying on your back with your feet bent, using your buttocks or your hips, lift your hips up towards the ceiling, and then down. Initially, if this is too challenging, you can just put your hands on your glutes and just squeeze your glutes for 3 seconds, and then relax. And over time, as you get stronger, you can progress to lifting your hips up off the floor. Make sure to feel your tension in your hips, not your back. Level 2 is the box squat. So getting a box or a bench and keeping our weight over our midfoot, we're gonna squat down and up. Over time, I want you to stagger it so you emphasize the right leg more in this position and then the left leg more in this position. Initially, if you need to reduce your range of motion and or hold on to a support, that's fine. Forward facing step up. With a small step, we're gonna stand up with our hip and then step down. Make sure not to lean too far forward or let the pelvis tilt. Over time, you're gonna increase the height of the step. And then lateral step up. So we're gonna step up in a sideways direction, again, using that hip, and then back down. We recommend just doing one side at a time and then alternating rather than stepping over, because it can cause an imbalance. If you feel fine doing that, that's fine. But again, it's probably best initially just to do this, and then over time increase the height of the step. So standing exercise abduction. So it's like we're gonna lift our leg away from our midline. So we're gonna place the inside leg between the ball and the wall. And pressing into the ball, we're gonna lift our leg up and try to get to a 90-90 with our hip and knee. Now again, you might have limited range of motion, so you can maybe only bring it up partway. That's fine. The main goal is that you're pressing your lower leg into the ball as you raise it up, pause, and then return to the starting point. So standing adduction. So think pressing our leg towards midline. So this time we're going to use our outside leg and put it into the ball. So again, pressing our lower leg into the ball, we're going to raise our leg up while getting pressure into the ball and then down. And again, you can tinker with the range of motion, but the goal is to press in comfortably and then return to the starting position. And then standing flexion. So this time we're going to place the front of our shin against the ball in the wall, and then maintaining pressure into the wall, we're going to raise our leg up, keeping that pressure, and then return to the starting position. Again, you may need to tinker with how far you go up or how high, but the goal is to keep pressure into that ball through the entire movement. Risk factors for OA of the hip are age, being female, obesity, genetics, major joint trauma, FI hip impingement, or heavy load occupations such as being a farmer. And since stiffness is one of the inherent symptoms of this condition, it may make you think that stretching is helpful. And light to moderate stretching is helpful, but high intensity end range stretching of the hip will only cause this condition to be worse. So again, if you look at the hip joint, the picture on the left is a normal hip. The picture on the right is an arthritic hip. And if you're cranking on the end range and really stretching hard, you can further damage the condition. And that stiffness you're feeling is probably more of guarding than you need to increase more range of motion. Again, the bones have changed, which is limited range of motion. More stretching is not going to increase that. And then lastly, does your hip pain get worse when it's cold outside or when it rains? 62% of people believe that their hip pain was worse when it was cold outside or there was change in precipitation. However, these two studies found little to no effect in changes in weather and hip pain. The thing is, our beliefs and our brain is very powerful, and so if you strongly believe that cold weather makes your hip pain worse, it's probably going to be worse. Thank you for watching our video on hip osteoarthritis. We hope you found it educational and helpful. If you did, please like the video, subscribe to our channel, and don't forget to turn on notifications.